Hello and welcome to my presentation. My name is Isabella Torreson and today I'll be doing a presentation on heart electrophysiology. We will cover the topics of the role of action potential and the blood flow through the heart. The first subtopic I'll be taking you through is how the heart contracts. So we have two different types of contractions. We have atrial contraction and ventricular contraction, and what this means is basically the atriums contract and then the ventricles contract. So in order for these contractions to occur, we need electrical signals, which we'll cover this later on in the PowerPoint. These electrical signals let the heart know how long to contract for, how fast to contract, how slow to contract. It sets a rhythm for the heart. Now, within these different types of contractions, we have subcontractions. So we have systolic contractions and diastolic contractions. So in this side, this left side of the diagram, we have the atriums performing a systolic contraction. So they're pumping the blood into the ventricles. The ventricles are now performing a diastolic contraction, so they're filling with the blood. On the contrary, on the other side, we have the ventricles performing a systolic contraction and the atriums performing a diastolic contraction. Now, as we'll cover later in the PowerPoint as well, it's important that the high to low pressure gradient, the contractions, and the electrical signals work together to perform a automatic sinus rhythmic pattern of contractions. If this doesn't occur, the patient could potentially suffer cardiac arrest and unfortunately pass if there's no medical intervention. Blood flow through the heart. So in this diagram up here, it states the different steps the heart must go through in order to pump efficiently. So firstly, deoxygenated blood travels through the superior vena cava and the inferior vena cava into the right atrium. From here, the oxygen-poor blood travels through the tricuspid valve into the right ventricle. The right ventricle then pushes the blood through the pulmonary valve into the pulmonary arteries to be sent to the lungs for oxygenation. Now we call this pulmonary circulation. Okay, so pulmonary circulation is where the deoxygenated blood travels to the lungs through the capillaries in the lungs and meets the alveoli. And the alveoli perform oxygenation where it oxygenates the blood. From here, it travels back to the heart and enters the heart via the pulmonary veins. The pulmonary veins then send the blood into the left atrium. The left atrium contracts, pushes the oxygenated blood through the bicuspid valve into the left ventricle here. Now this muscular left ventricle forces the oxygenated blood through the aortic valve and through the aorta, which distributes the blood variously throughout the body. Action potential within the myocardium. So action potential begins with the process of cardiomyocytes. It begins with the cell at a voltage of -90. So in this graph here, the voltage starts at -90. As potassium is continually leaked out of the cell, as shown here, while this is happening, a few sodium and calcium ions are leaked into the cell via gap junctions, causing the voltage to slightly rise to -70. Once this threshold is reached, voltage-gated sodium channels are opened and rapid depolarization occurs as a lot of sodium then enters the cell. According to the concentration gradient, once the voltage reaches a positive charge, the sodium channels are closed and other voltage-gated potassium channels are opened. But before the voltage dips down to a negative charge at roughly 5 milliamps, voltage gated channels are open. With the calcium entering once the potassium is leaving, a plateau in the voltage is created. So it's created a plateau here. Finally, the calcium channels are closed and the remaining channels bring the voltage back down to -90 here before the whole process repeats. The conduction system of the heart. There are specialized cardiomyocytes that make up the sinoatrial node. Situated at the top of the right atrium, the sinoatrial node is responsible as a pacemaker for the heart. It regulates blood flow in an orchestrated rhythmic manner. The electrical signal created by the SA node travels along the internodal pathways, where it either travels into the left atrium via the interatrial bundle or through the internodal pathways towards the AV node, also known as the atrioventricular node. From the AV node, there is a minimal delay before it continues down the septum into the bundle of His, also known as the AV bundle. These branches in the AV bundle then divide into the Purkinje fibers. So down the septum into the Purkinje fibers. This then has the ability to reach all parts of the lateral ventricular wall. The electrical signal dictates when and for how long the cardiac muscles contract, which ultimately moves the blood in the intended direction. The need for the delay in the signal past the AV node is to ensure the atria both have enough time to contract before the ventricles begin. This way, the use of the pressure gradient and the relationship between the systolic and the diastolic contractions ensure the blood continues moving in the right direction. Without the delay, the blood would stay in all 4 chambers of the heart and fill up, unfortunately causing heart failure or cardiac arrest. Assuming the pacemaker is working correctly, assuming the SA node is working correctly, the oxygen depleted blood begins the form of the blood flow through the heart via the superior and inferior vena cava. I hope you all enjoyed watching my PowerPoint. Thank you for listening, and I hope you enjoyed.